Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Ethopropazine. Its brand name is Parsitan. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Ethopropazine. We'll then touch on an example of dosing and finish it off with side effects. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So the mechanism of action of Ethopropazine has not been established. It does possess strong atropine-like blocking activity on parasympathetic innervated peripheral structures. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see this medication prescribed in the treatment of extrapyramidal disease or medication-induced movement disorders. As well, this medication may be used to treat Parkinson's disease. With respect to contraindications or reasons we would not be able to prescribe Ethopropazine, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Ethopropazine or to any other component of the formulation. If a patient had glaucoma, they would not use this medication, as well as patients who have prostatic hypertrophy. We'll now discuss dosing of Ethopropazine. So the initial dose is generally 50 milligrams orally once or twice daily. The patient would then have the option to increase the dose gradually if necessary. Patients with mild to moderate symptoms are frequently controlled with 100 to 400 milligrams daily. And in severe cases, the dose may be gradually increased up to 500 or 600 milligrams daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Ethopropazine. We'll go over some of those here now. Some patients may experience hypotension or low blood pressure, as well as a rash, nausea, or vomiting. Epigastric pain is a possibility with this medication, as well as xerostomia or dry mouth. Some patients may experience constipation or a granulocytosis, as well as jaundice, which would be a yellowing of the skin. Muscle cramping, involuntary movements, and drowsiness may occur in some patients, and some patients may experience forgetfulness, confusion, or headaches. Ataxia, blurred vision, and visual hallucinations are side effects of this medication, as well as urinary retention. Alright everybody, that's all we're going to talk about today with Ethopropazine or Parsitan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.